Hey everyone! Welcome to this Carecraft Nursing Explainer. If you're about to step onto the hospital floor, or if you're prepping for your clinical exams, you are in exactly the right place. Today we're breaking down one of the most fundamental, and honestly, potentially high-risk skills in patient care, Foley catheterization. We're going to make this incredibly straightforward, visual, and highly memorable for you. All right, let's dive right into our clinical roadmap for today. 1. Introduction to Foley's catheter. 2. Clinical purposes and indications. 3. Catheter types and sizes. 4. Essential post-procedure care. And finally, 5. Managing potential complications. Part 1. Introduction to Foley's catheter. So what exactly is it? Well, notice the heavy emphasis on the word sterile. A Foley catheterization is fundamentally a strictly sterile medical procedure. You're carefully guiding a flexible tube right through the urethra and directly into the urinary bladder. Why? Mostly for reliable, continuous urine drainage. Now, I know it sounds pretty simple, but maintaining that sterile field, it's literally everything. You're dealing with a direct, open pathway straight to the patient's kidneys, so we really can't mess around here. Moving on to part 2, clinical purposes and indications. Okay, so why are we actually doing this? We use these for several absolutely critical reasons. First up is relieving acute urinary retention, which is literally just emptying a bladder that simply can't empty itself. But honestly, it goes way beyond just quick relief. We use them for precise perioperative monitoring during surgeries to make sure the kidneys are doing their job while the patient is out cold under anesthesia. It's also super vital for getting accurate urine measurements in critically ill patients, managing folks who are immobilized long-term, and supporting patients with a neurogenic bladder, where nerve damage disrupts natural control. Oh, and it's essential for providing assistance during specific urological procedures. So yeah, it's a very versatile tool with massive clinical importance. All right, part 3, catheter types and sizes. This part is fascinating because it really shows the engineering behind patient care. We basically have 2 main types. The standard 2-way Foley has exactly 2 ports. One is for urine drainage, and the second is to inflate the securing balloon. But then you have the 3-way Foley. That extra third pathway is a continuous bladder irrigation port, or CBI. And let me tell you, this is an absolute game changer for patients experiencing hematuria, or blood in the urine. It allows us to continuously flush the bladder and prevent dangerous, painful clots. Now, a completely crucial point for both your clinical exams and your daily floor practice is memorizing these specific sizing guidelines, which are measured in French units. Pediatric patients are going to need smaller sizes, usually around 10 to 12 French. For adult females, the standard is typically 14 to 16 French, and for adult males, mostly just due to anatomical differences, we generally step up to 16 to 18 French. Hitting the nail on the head with the correct size is essential. It maximizes patient comfort and, more importantly, prevents urethral trauma. And right alongside that sizing data is this magic number, 10 to 30 milliliters. Once you have that catheter perfectly positioned in the bladder, you're going to use between 10 and 30 milliliters of sterile water to inflate the balloon through that inflation port we talked about earlier. This balloon is exactly what anchors the catheter safely inside the bladder so it doesn't just slip right back out. Next up, part 4, essential post-procedure care. Think of this as your essential daily workflow. First, strict intake and output monitoring is totally non-negotiable. Second, you have got to frequently check catheter patency, basically just making sure the urine is actually flowing. Third, and this is a huge one for preventing retrograde infections, always keep that drainage bag strictly below the level of the patient's bladder. Gravity is your best friend here. Fourth, perform daily catheter care using an approved antiseptic solution. And finally, the absolute best way to prevent an infection is early removal. If your patient doesn't clinically need the catheter anymore, advocate to get it out of there. And that brings us to part 5, managing potential complications. Even with perfect technique, you always need to be on high alert for these clinical red flags. UTIs, or urinary tract infections, are incredibly common, and they're the main reason we stress that early removal. You also need to keep an eye out for physical catheter blockages, which, remember, might require that 3-way irrigation we discussed. Patients might also experience some really painful bladder spasms. And on the procedural side of things, improper insertion can lead to severe, literal emergencies like creating a false passage or causing direct urethral trauma. Being able to recognize these instantly is exactly what makes you a top-tier healthcare provider. To make sure you catch our upcoming posts, which are going to be packed with exclusive equipment details and advanced procedure tips, you've got to stay connected. Make sure to subscribe my YouTube channel and follow me on Instagram and Facebook, link in the description and bio. But real quick before you go, ask yourself this. The next time you're ordered to place a Foley, are you just going to be completing a task, or will you be visualizing the anatomy, the fluid dynamics, and the precise risks you're actively preventing? Keep studying smart, stay sharp, and we'll catch you in the next explainer.